minute here is one of those things that, we think about food, and food is really one of the ultimate medicines. Food is information, food is nutrition, food is information, and then food is basically a way to inform your genetics, but also your cell health. So essentially what can happen is that there's food, but then there's also oxygen, and there's also light, and there's also other aspects that are also part of nutrition. So in a way, we could think of light as one of the ultimate nutrients as well, because nothing can function without light. And one of the big wavelengths of light is actually red light. That's what we're going to talk about today. So we can go on to the next slide here, and how red light therapy can help your health and wellness. So we're going to start with the CH community updates, just briefly here, and just some of the updates on COVID, et cetera, that we've been doing over the past 6 months now. Welcome everyone who just joined too. Thank you for joining us today again on this Thursday. You can go to the next one. So cases are still decreasing in Maryland. However, there are nationally almost 200,000 deaths from coronavirus, and there is still no FDA-approved antiviral treatments, although there are some newer treatments that are, I think, antibody treatments that are being developed, trying to be developed commercially in Pittsburgh. This just happened fairly recently. I didn't put it up here, but there are some potentially either medications or antibodies that people are looking at. There are many ways to optimize the immune system as we kind of look for potentially vaccines and other treatments for COVID. The kind of the lifestyle that we always emphasize here at CIH: sleep, mindfulness, activity, eating real food, and also eating real, I should say eating real light, but light is a nutrient as well. So our skin, our organs are eating real light, and we're going to talk about vitamin L today. But that's also, I think, part of real food is getting outside and getting food for your cells, your mitochondria, which is the batteries inside your cells. That is also food as well. And then ties or relationships, connecting to community, knowing that community is really what moves the needle in health and wellness. Being united, having support, for each other, friends and families and community, that's really important. Walking in nature, vitamin D, acupuncture, red light therapy, which we'll talk about today with Araceli, IV vitamin therapy, low-dose naltrexone, and many other things to optimize your immune system. And you can feel free to put in the chat box here. We're going to go on to the next slide, but if you want to chat about what you're doing, another question we had last week, but that's, I think, good to kind of keep on talking about, and being active in your health. What are you doing to optimize your immune system? You can always put that in the chat box. There are 3 major vaccine trials underway. The one that had a serious adverse reaction that is still unexplained, and one participant, that trial did resume in the UK. The Oxford trial, and then the NIH and BioNTech are also still underway. Interestingly enough, a CNN poll showed that 40% would not want a vaccine, even if it was free and available. So the US government has decided to make the vaccine free for everyone. There may be some copay related to administration of the vaccine, but that was just said yesterday, the day before, by the administration. So that's sort of an interesting, concept. Safety and efficacy of the coronavirus vaccines have yet to be established because the trials are not completed yet. But we're keeping close eye on that. We'll keep you updated every week about that. Okay, so, and then we have a flu vaccine that is actually here, I believe, this week now. So you can please message the CH inbox, a message administrator there will express interest in the vaccine and to be placed on the list to get a vaccine. This vaccine, flu vaccine, is actually egg-free, preservative-free, and mercury-free, and it is available now for the second year in a row here. You can do IV immunoboost 3 days beforehand, which is a nice way to boost the immune system, protect your gut. Also taking probiotics and different other things to do, getting a lot of sleep will really help to maximize the antibody protection that you get from a flu shot. Bev, hey, welcome. Good to see you, Bev. Great to see you again. Finding that staying in relaxation mode helps the immune system. Absolutely. So we're having a few things happening again, try to be as best service to the community as possible, of course. We have a free webinar next Tuesday. This is one that's open to the public and to patients. This is called Health 101, How to Keep Your Immune System Strong. So we'll be doing that on Tuesday, September 22nd from 4 to 5 p.m. So please join us for that. Love to see you there. And then today we're talking with Araceli on red light therapy to optimize energy. And we also had this month Liz Reese talk about back to school, easing the transition Jay Gill, pharmacist, talked about compounding RX last week. You can listen to the recordings on our Facebook page. And then there's a link for the next webinar, which is next week. Dr. Carrie Jones, who's an expert, nationally known for expertise in hormone balance. She's a naturopathic doctor and also the medical director of the Dutch test that we use a lot in functional medicine. So she's going to be talking about hormone balance for your best life in the Q&A session, and I'll be on there with her, and it'll be a really good time. So I hope you're on there too for that next week. Great. And then we have a pain and rehab summit that I participated in, talking about low-dose naltrexone for chronic pain. There is a free registration that is going on right now. I think that was just something I kind of did to be of service to people, and that's something that is more of a link that you can just go on there and register. So I hope that's of benefit to you if you have pain, if you're trying to rehab from some arthritis or some pain. That can be really helpful. There's a lot of doctors on there, a lot of physical therapists, a lot of people on there that are experts in pain and rehab. Darcy, that's a good question. Welcome, Darcy. Thanks for coming on. Do you think Epsom salt bath soaks are helpful for pain and detoxing? Yes, we recommend that quite a bit. Absolutely. You can also add a little bit of bentonite clay to that, and that can help a lot too. Okay, we can go to the next slide. So let me see if there's anything else. I think that's good. And then we can introduce Araceli here. And welcome, Araceli, and thanks for being on today.
Yes, thank you so much for inviting me, Dr. Wong. And
Yes.
thank you so much, everyone, for joining us today to learn more about light, the power of natural light, and also red light therapy. Today, we'll be covering what is red light therapy and many common questions that we have about it, like how does it work, what benefits does it have, how is it different from a sauna, is it safe, and much more. But first, before we start talking about all of these, we would love to hear from you. Have you ever tried red light therapy? We'll have a polling question here. We would love to know how many of you are familiar with it. And also feel free to chat on the box if you have tried it either here at CIH or at home. How was your experience? We started doing red light therapy here at CIH around 6 months ago, and we've been having a lot of success with it. So I'm very happy to share how this works and what benefits can bring to you. So we're happy to hear if any of you out there have been with us or either have their own panel at home. Let's see if we... Okay, so 27% of people that are attending today has tried it already. And we have a few that haven't, but I'm very happy to see if after what we speak, maybe you're interested in trying it. And also we'll be talking about natural light. So there are a lot of things that you can do on your own, that just the benefits of getting outside and getting exposed to sunlight. So as Dr. Wong said, we normally tend to focus a lot of our nutrition and making sure we get all of our vitamins and minerals, but sometimes, especially nowadays that we are all working indoors and staying inside with the pandemic and everything, we often miss one of the most important vitamins, that is vitamin L, that will be the light. So we'll focus a little bit, and Dr. Wong will talk about now the benefits of sunlight exposure.
So the EPA does, thank you, Araceli. The EPA does estimate that 93% of people spend their time indoors, and I think it's more like over 95% now with COVID.
Mm-hmm.
I don't see as many kids playing out, you know, in the park. Although that's changing a little bit when the fall kind of hit. There's less heat and, you know, everything. But I mean, people don't spend time outside. If you go outside in your neighborhood, walk around, you know, not many people are really out, you know, a lot of times, and we're always working indoors a lot of times, a lot of us. So natural light is essential to human health. That's how we're created. That's how we evolved. And the wavelengths of natural light stimulate the batteries of your cells called the mitochondria. And sunlight is also needed for the production of vitamin D. That's important for bone health, blood health, basically cardiovascular health, and just cellular health in general. And then, of course, your immune system. And light also importantly regulates our circadian rhythm. We have a natural clock in the middle of our brain called the hypothalamus, called the SCN, suprachiasmatic nucleus, and which you kind of see here. And that's the most important clock to go by rather than your wristwatch. It's really these 24-hour biological clock that regulates the sleep-wake cycle, the metabolism, hormone release, and body temperature. And light has the strongest effect on the circadian rhythm of anything, both natural and artificial. So if we're basically having environmental light, bright lights during what's called solar darkness, basically when the sun is dark, or when the earth is dark and the sun's down, that influences the circadian rhythm, circadian pacemaker in an adverse way, so that organs get confused. Your organs kind of say, hey, wait a minute, it looks like it's daytime because I have my night lights on. So then the function of the body becomes compromised in that case. But conversely, if you kind of more are kind of wedded to more of a natural kind of light and dark rhythm, the sun moon rhythm, and you're kind of in balance with nature, then your organs function better. Did we skip a slide? I don't know if I was talking over that. Oh, thank
Yeah.
you. Might have.
Yeah,
So,
sorry.
sorry.
I came
So
back
the
to
so the light spectrum. So we talk about light bulbs, and light bulbs can be fluorescent or they can be full spectrum and different things. But the visible spectrum is going to be it's going to be right there. It's going to be starting from red. You've all heard that acronym Roy G. Biv, but basically it's red, orange, yellow, green, blue, indigo, and violet. So that's going to be your visible spectrum that you see, and you see that as white light because all those colors of the rainbow or whatnot, you see that as white light. But there's different aspects that you can kind of parse out. So people actually use green light and blue light and different things for different conditions, but we use red light here for specific conditions to optimize the immune health, to optimize energy. And you see that there's you see the visible spectrum is a tiny piece of the whole electromagnetic spectrum. So our bodies are energy, our cells are energy. So we're all electromagnetic beings. And so all of these aspects, whether we talk about radio waves on the left, radar, TV remote, the sunlight, the ultraviolet rays, and then if you head to the right side, when it becomes more of a more higher frequencies, I think you have X-rays, you have gamma rays, and things like that. So all of these aspects can affect our health because we are electromagnetic beings ourselves, and you see that all these invisible parts of light can be really can be really affecting your health. Now, in the infrared spectrum, there is near infrared, mid infrared, and far infrared. So that's going to be in here, and that near infrared is going to be one of the things that we see in our red light machine here. But that's going to be invisible. You will not see that part of it. You only see the red light part of it. But there are two aspects of light that we have here in our specific machine called the Juve red
yeah.
light.
Thanks
So we
for
can.
the
Thank you.
Before we jump into talking about the mitochondria, I wanted to share that Anne shared with us on the chat. I love it. She said it gives me energy and has improved my skin appearance, reduced mild arthritis pain in my fingers. So thank you so much, Anne, for sharing that, and we'll talk about how all of those benefits happen right now in just a second. So now we can go to the mitochondria. So one of the important things of understanding how light therapy will help us is understanding what the mitochondria does for our cells. And we'll just use some analogy that the mitochondria is kind of the battery that we found on our cells. So this is needed in every single of our cells in our body, even if they're found in the brain or the liver or the skin. So it's necessary that these mitochondria will be filled with batteries so that they can do their appropriate function. So it is very common to see mitochondrial dysfunction in many of these conditions: chronic disease, stress, and aging. And mitochondrial dysfunction is just the inability for the cells to produce the energy. So it's kind of like they're losing their energy, their low power. And the main symptom we'll see, and it's very common in many diseases, especially chronic diseases, is feeling fatigued. So once the mitochondria is not able to do energy efficiently, it will produce free radicals, and these are very dangerous molecules that will create oxidative stress in our body, and that can damage DNA. So this is very important to understand, to make sure to understand how like the red light therapy would also benefit us. So if we ask ourselves what is red light therapy, it is also known in the research, it's also known as photobiomodulation and also low level light laser therapy. So these are just medical grade LED devices, and it delivers natural wavelengths of light. As Dr. Wong was explaining, there were those low levels of wavelengths of the spectrum of light. It is powerful and non-invasive, and it can modulate the metabolism. And as Dr. Wong said, the red light will be able to see it, as we see here in the panel. but the near infrared light, it wouldn't be visible to the human eye. It does not contain any UV light or excess heat or artificial blue light that has shown to affect negatively the circadian rhythm, or it would not burn the skin. It doesn't get really hot, so that's very important to keep in mind for the safety part. Here the same, so the red light portion that is the visible part will be more focused on skin, and the external part, it stimulates the production of collagen, so it's very important for skin health and can also benefit the eyes, that we'll see in a second. And the portion of the near infrared light is the one that will be able to penetrate deeper in the skin, around 8 to 10 millimeters. And this can influence more the nervous system, the metabolic process, immune system, and much more. So how is it possible that the near infrared light modifies so many things? This is the basic reason why. So if we're talking about mitochondria as being the battery of the cells, we want to think of the red light as being the charger for the batteries. So this will help us charge our cells. This happens during cellular respiration, and this will make the cell produce more energy to do their own functions. So if we combine this near infrared light that is able to penetrate deeper in our body, plus chlorophyll, that is the component, the green component on fruits and vegetables, so we can, if we have it as a green juice, it's even sometimes more concentrated. Of course, we don't want to add a lot of fruits on it to avoid having a ton of sugar. But if we combine these two, this will activate something that is called cytochrome C oxidase. And this is found in these batteries that we were saying of the cells. And therefore, more energy will be produced, and then the cells will function optimally. Here we can see maybe some neurons doing their functions, or the immune system ready to work properly. And by having all of this energy production, it will help fatigue. So a lot of patients that will come with different conditions, but overall having fatigue, this will help boost the energy in the body. So also, red light therapy would help increase the circulation, and this will be very important for healing processes, bringing more oxygen and nutrients to places that may need to be repaired. This will be very helpful. And also, being able to produce energy very efficiently in the cells will prevent having these free radicals that are these mad molecules that we see over here in red. And on the other side, we'll have more antioxidants. So these antioxidants will lend this kind of ball that would be an electron to help these free radicals be stabilized, so they won't be mean anymore and they wouldn't try to attack our normal tissue. So that's the mechanism how it does it. And once we have this more stable, our cells will have an environment more friendly. So they will be able to, they will be happy like we see here, and they will be able to carry out their normal functions, such as synthesizing protein or making enzymes or normal cell cycle progression. So here, how long should I do red light therapy? That's some questions we also get. So here you can see a picture just of me enjoying some red light. It does feel great. It's very relaxing too. So basically you need to stand 6 inches away from the panel, these LED panels. And the more portion of your skin you can expose, the best results, because you'll have more cells in your body absorbing all of these good light to create more energy. And approximately 10 to 20 minutes, it's enough to get the benefits. If patients are sensitive, they have like detox reactions, or they're very sensitive to light, we do start slower. We can start at 2 minutes if necessary. And we also have some goggles. If patients tend to get migraines triggered by light, they can also use goggles if they need to protect their eyes. But this is actually beneficial, also a beneficial light for the eyes. It will be ideal to use the red light daily, since it mimics the exposure to natural light every day. But if not, we also see that there are many studies that shows benefit by using it twice per week, or 3 times per week even. So it will depend on the condition and on the person, and how often would they have to use it. It can be done any time of the day. It would not disrupt your sleep, but preferably would be in the morning, so it would be more in time with our normal circadian rhythm to be exposed to this light in the morning. And so what intensity is ideal when if you're trying to see which brands or which types of red light therapy would be convenient? The proven wavelength that has been shown is for red light in the mid 60s on the nanometer range, and for near infrared light, it will be mid 80s. So it is important to note that the benefits that you'll get from this red light, it does depend on how often you'll do it and what intensity. So this dose that we see here, it will be calculated on what's the intensity of the irradiance that is being given by the panels, how far you are, what's the amount of skin, the surface area of the skin that is being exposed. So we did calculate it, well, Dr. Wang calculated at the beginning, and with the panels that we have here, 10 minutes a day should be enough to get this nice point here of having the most biologic effect that you can have. But if you've tried red light therapy before, just a few times, but did not get to that point, maybe you need a little more to actually feel the difference and the benefits that we'll discuss in a few minutes. So safety first. Clinical reports have stated that it is safe, that doesn't have side effects or risks. The only thing we've noticed is just with patients dealing with detox, it's important that they have other ways, if toxins start like circulating or things, just other ways to support their detox. But besides that, no UV, no blue light, or no excess heat. And it's important that the device is registered by the FDA. It is actually beneficial for the eyes. Research showed that it can decrease macular degeneration, progress, glaucoma, eye injuries, and protect against vision loss. So that was very good to see, because there were a lot of patients that...
And a few people asked about how does it help the eyes. I believe that because red light therapy boosts the mitochondria, and all these conditions are related to either vascular issues like in terms of pressure, glaucoma, but also macular degeneration is a mitochondrial issue with the eyes. If you take red light therapy, especially near infrared, for the mitochondrial side, that's going to boost the batteries inside your eye cells. I believe that's how it works for the eyes.
Yes, right.
Thank you. Yeah.
Mm-hmm. So the main difference between the red light therapy and the sauna is their mechanism of action. So sauna would rely on the heat that it produces to make you sweat, to vasodilate the vessels, to support many things. It's also great, but it's different than the red light, that it doesn't use the heat, and it's more natural wavelengths of light that will penetrate the skin and the cells to have their benefits on the mitochondria. So
a few people asked about sauna a little bit ago. Is it considered to be red light therapy? I believe that some saunas have the option of installing red light panels in the sauna. There are some, I think Therasage is one. I think Sunlighten might, I'm not sure about Sunlighten, but definitely sauna and red light therapy are slightly different, like Araceli explained here. But there are some overlapping benefits, but there are definitely some differences as well.
Mm-hmm. Yes, and I saw there were some questions of if you can do the eyes open or the eyes closed. You can definitely keep your eyes open. Actually, your eyes start to adapt to the light, and while you're doing the therapy, you stop seeing the light as red as it is, and you start seeing kind of amber light, and that's completely normal. It's just your eyes adapting, and you can be with your eyes open if it doesn't bother you. I think there were a few other questions.
Yeah, so let's go back to the, so first of all, Mustafa, thanks for that question. So with the pacemaker, there's not studies that show if it's safe or unsafe. I'd probably be a little conservative there and just kind of get out more in like natural sunlight, actually, for that. I think if there's a pacemaker issue. It's probably not unsafe, it's probably safe, but it's not totally proven yet for that. Also, let's see. Yeah, Darcy, I feel drained. She said, I feel drained when I spend too much time on the computer and on the phone. Yes, I think now that's interesting because someone else asked about blue light. Let me see. Also Darcy. Okay, so about blue light. Now, blue light is activating. So you want, if you're going to use the computer, ideally it's good to use it in the morning because, basically indoor lights tend to be more blue than red, and computer screens tend to be more blue than red, and same with cell phones. So if you're going to try to activate your system, boost your cortisol, boost your energy, kind of get revved up. You want to do that more in the morning, because that's more of the time that most people are awake, or that's when the circadian rhythm, it should be, you're more energetic. So blue light and red light, it's not like blue light's bad, but having too much blue light at night or excessive blue light throughout the day, especially in a short distance from your eyes, from your retina, can actually damage the eyes. And we see that. That's why people on tablets, they should put the blue light blocker glasses on. Sometimes if you're on the computer a lot the whole day, you put the blue light glasses on right now. Thank you. So things like this, blue light blockers, but you don't have to have them on the whole time. But I think having it on intermittently would be good. So really, we're probably getting, based on the amount of screen time we have, too much blue light and too little red light is probably what's happening here, right? A lot of times, it's not that blue light's bad, but the ratio between red light and blue light is a little bit in favor of blue light usually. What else is on here? Let's see. Thank you for all the questions. These are great questions today. Thank you. John, that's a great question. Welcome, John. Good to see you on here. If I get lots of sunlight, would red light therapy be redundant? What do you think, Araceli?
I don't, depending if you feel like you still need a boost, like if you still feel fatigued, even if you're being exposed to sunlight and you need extra support with it, I think it's more, since it's more concentrated and focused on it, maybe it could still benefit.
Because the near infrared light part of the spectrum of light is what's boosting the mitochondria. It's not the red, it's the near infrared, which is part of the red light machine. But the blue light and the other pieces of light, that's not what's activating the mitochondria. So you're getting the sunlight, you're getting a piece of that near infrared light in general through more of a full spectrum. But I think red light is like Araceli said, more concentrated. So it'd probably help you just more. It's almost like I don't know. I mean, I think food always, food first. Taking like turmeric as a root. If you like, put turmeric on your food versus like, which is good and it's anti-inflammatory, versus like taking a curcumin capsule. Like if you have arthritis or some chronic pain or something where you really want to reduce that inflammation, you can take a curcumin capsule. So that's how I'd look at it for this.
I agree. Like getting out 10 minutes during the morning before midday would also have great benefits of just being exposed to natural sunlight. And then if you still feel like you continue being fatigued and there's something specific needs to be addressed, I think red light therapy would be a great option there.
Yeah, and from an ancestral health point of view, in terms of how much light we need for like getting out in the sunlight for basically optimal health, I think there's a couple considerations. One is how much can we tolerate without burning ourselves? And that depends on our skin complexion. People with darker skin, that might be like 1 hour, 1.5 hours without burning, but other people with fairer skin, that might be like 5 minutes. Right, so there's that aspect in terms of how much are you outside, how much skin cancer risk is there. But you do want to get outside and you want your skin to be warm without burning yourself, so that wouldn't increase the risk of skin cancer. But at the same time, you want enough light to activate your mitochondria. If you don't have enough light, and a lot of times people try to get out ideally maybe 1 or 2 hours at least, and how much time do we have for that? That's always the other question is, a lot of times we're not out except on the weekends, or unless you have like I guess if you're like teleworking or something and you're outside all the time, that's kind of nice. But yeah, I mean, I think that's part of it is, getting outside for 10 minutes is sort of the minimum to activate your circadian rhythm in the morning. But how much is optimal, right? Just like we talk about traditional labs and functional labs, we can talk about a vitamin D level of 20 to prevent scurvy, but we can talk about a vitamin D level of 50 to 80 to help with autoimmune conditions or help with chronic pain. So I think you think about what's minimum and what's ideal, and then having that concentration of red light can be really helpful in those situations when you're not getting out for an hour or two a day. That can be really helpful.
Dean had a very good question. The sunblock block red light. I know it would block our ability to do vitamin D. I'm not entirely sure about red light. Would it, Dr. Wong? Do you know?
We'll have to research that, but if you think about it, light's trying to penetrate the skin, so I think it would. I mean, I don't see why, because that's because if you think about what sunblock does, it prevents you from getting sunburn. But the way you get sunburn is through ionizing, radiation or aspects of light in general. So I think it would. I don't see why it wouldn't, but we can do some research on that. Sunblock is, I mean, I don't know how much we want to talk about that on here. It's somewhat controversial. I think it can be helpful to reduce skin cancer, but especially if you take the wrong types of sunblocks, that could actually cause chemicals to go in your skin And so, things like zinc oxide or, things like that, but not the really micronized ones, because then that might not be good either. So that might be a different topic. Maybe we'll do a whole, how many people want to have a session on dermatology? I think that would be pretty cool to have a one just about the skin. Just just chat or something. If you do, we'll try to make that happen. If you want, if we want to have a wellness webinar on a skin session, I think everyone loves talking about skin, right? Everyone wants healthy skin. Let's see. Yes, great. Thank you. Thanks, Meredith. Thank you for all the votes. Thanks, Alvina, Sarah. Thank you, everyone. All right, so let's. There's probably a couple other questions.
Yeah.
Do you have to be in a dark room to use the red light?
No.
No, definitely not that. EMF, is there electromagnetic radiation? Was that on the slide? I'm trying to remember if that was.
It wasn't on the slide, but they referred that it was minimal or none.
It's minimal. I mean, all electronic devices, the computers you're watching this from, the cell phones, even the red light panel, it's not no EMF, but it's very low. It's negligible, and they do measure these. And I think any good company like a Sauna or a red light therapy machine company, they should have documents if you call them to basically you look at that. And Ari Whitten is a health advocate and athlete, I believe, and he talks about chronic fatigue a lot. And Ari Whitten wrote a book that we can share the information in here. Maybe Jen, you can type that in, The Ultimate Guide to Red Light Therapy. And I think he has some estimates of the EMF in his book in terms of different machines and his recommendations on the different machines. I don't think, Tony, hey Tony, I don't think the sauna every day versus plus red light therapy every day. I mean, you could overdo it, I guess, if you like dehydrate yourself in the sauna. I don't know that I would do sauna and red light every single day. That just seems like a lot to me, but I guess if you can tolerate it, I guess there's nothing wrong with that. I know in the Finnish studies, they did have people doing it 5 to 7 days a week, and it did show a decrease in mortality in people that were doing sauna for that long. Okay, what benefits? Thank you. What benefits do you want to hear about most because we're going to now go into some of the research about red light. And this is going to be an exciting part here. Inflammation and joint pain, or you want to read them off is good too, it's fine.
Sure, so sleep or skin, some hormone research on thyroid, estrogen, also testosterone, seasonal depression, immune system, blood pressure, muscle recovery, and gut health. We'll be happy to know where your interest is the most to spend more time on those topics today. Let's see.
Great. So thank you for your votes in this election year. Make sure we have voter participation, regardless of. So inflammation and joint pain. So definitely that and immune system were tied for first place on this. Great. Gut health, definitely always there. Sleep, yeah, love to. There's so many interesting and hormones also. Actually, hormones was also really good on there. So a lot of people interested in a lot of things. And interestingly, red light affects photobiomodulation or red light therapy can benefit all of these aspects. Like optimize sleep, help with skin health, thyroid function, which is surprising to me. Helping with brain health and dementia, joint pain, seasonal depression, and inflammation. Now, someone asked about seasonal depression and the SAD light boxes. I believe those are full spectrum. They're not the red light. And usually for activation, you want that blue light, actually. You want that blue light. So the full spectrum would be better. But I think if you're doing it for depression and other things like sleep and energy, then red light therapy would also help. So, if I had to just choose one between, getting the biggest bang for the buck, if it's more of a SAD issue and, a seasonal affective disorder and you have a little machine at home and that's very helpful to you, then use that. But if you're doing it for like inflammation, opening up your vessels, increasing blood flow to your brain and all of that kind of stuff, then I would probably choose red light if you could.
Right.
Memory and learning, yes. Okay, so we can go to the next.
So we'll start by learning about how red light therapy benefits inflammation and pain conditions. So as we saw previously also, while it increases circulation, this blood will go to damaged tissues and this will regenerate all the tissues that need repair. And this stimulates healing process, decreases pain, and increases recovery time. So again, going back to the mitochondria, we'll be able to secrete more anti-inflammatories, conditions and disease-fighting antioxidants, and this will decrease oxidative stress. So less inflammation, less oxidative stress is a way that we're able um, to manage pain conditions. So this will be important for joints, traumatic injuries, lung disease, and the brain. Of course, we want to decrease brain inflammation for all of the neurodegenerative diseases to prevent that. So it goes back a little bit to the same mechanism of circulation and mitochondrial health, but we see here some studies done specifically for arthritis. So in a study published in 2018 showed that this red light therapy can change the inflammatory course of arthritis. So this decreases pro-inflammatory cytokines, which will improve the pain. And also for patients in RA, a study that was a controlled trial showed 70% decrease in pain on RA patients, and also decreased morning stiffness in these patients using the red light therapy. I don't remember the exact dosage that they used for that one, but if I remember correctly, it was daily for RA. And then it can also increase regeneration and thickness of cartilage and decrease osteoarthritis pain. In some other studies, they did show that. That's when you want to jump in for immune?
Yeah, so our RLT, red light therapy and immune health. So red light therapy can help with immune function. And I think this is a really underrated organ, actually, is the thymus. The thymus is right here. You can see that above the heart, between the lungs, below the Adam's apple. So it's kind of like right here. And it kind of peaks in function in the teenage years, like 14, 15, which is kind of interesting. And then after that, the function starts to go down. Now, the thymus actually produces the T cells that are one of the major components of your immune system, fighting off viruses, bacteria, keeping your system healthy, preventing autoimmune disease and things like that. So the thymus starts to involute. It starts to degenerate a little bit and not basically shrink a little bit and not be as active. And a study from 2017 interestingly showed that both red light therapy combined with near infrared light therapy may slow or revert thymic involution. So by the age of 40, a lot of times a lot of people don't have a lot of thymus function. So this is actually one of these anti-aging type of therapies as well, is that it can help maintain thymus gland function. There's other things you can do for thymus gland function we'll probably talk about during one of our future immune visits, but that, you know, exercise can help, glandulars can help, but this is something that you can do, is get light, especially if you expose it to the thymus. Now, one of the things that Sarah asked, that's a great question too, is if you put it on the face, you know, if you basically get exposed red light therapy to the face, is that going to the, can that affect other areas? Well, the interesting thing is that red light gets absorbed. Again, it's like a nutrient. It's a light nutrient, gets absorbed to your bloodstream. So once the red light gets to your bloodstream, essentially, and that's activating, the photon energy is getting activated, that gets carried to your whole body. So regardless of where you put the red light, now I think if you put it close locally to an organ, the thyroid, the thymus, or, you know, the back, if you have back pain, you want to try to put it locally if you have a smaller machine on that. If you have a full body machine, that's probably better, but if you have a smaller machine, you can just focus it locally. But it'll benefit your whole body because of the bloodstream,
Mm-hmm.
because the photons are going throughout the bloodstream. So that's one study that red light can actually slow or revert thymic involution, basically preserve thymus and immune function. And in human studies, it also boosted the immune system and T cells of preoperative cancer patients without increasing tumor size. So that's really, really those are two great studies there.
Yes, it's very interesting how like supports the immune function without disrupting. Like even if it's like autoimmune, it wouldn't trigger it too much or anything like that. It would just support it in a very positive way. So that's
Yeah.
great. Okay, do you wanna?
So yeah, I can do. Yeah, so interestingly, we talked about blue light, especially. So blue light during the day is okay, it's better, but not the whole day. You want to put blue light blockers on, get outside a little bit to get your eyes kind of away from the screen, you know, constantly, right? But then blue light exposure at night is where part of the issue is that that's where the damage comes in, from computers, from smartphones, from energy efficient lighting, especially halogen bulbs and LEDs, more than incandescents that are kind of being phased out right now. But LEDs are also heavier in blue light than incandescents. So these have all been linked with increased alertness, dopamine rush, and delayed melatonin secretion, which is great if you have that during the day, but damaging at night, because melatonin actually helps to prevent cancer, reduces inflammation, and it reduces oxidative stress, as Araceli was saying. So red light therapy helps to regulate that circadian rhythm, so you have more of that red-blue balance there to promote better sleep. So again, as Araceli was saying, doing that red light in the daytime is good. You can, in theory, I know some people have, I know Jen was talking about this one time, having those red light lava lamps. Does anyone have those? I don't have those, but I know that red lights, I know my daughter sleeps better with the red night light than the blue night light. You can change the color on the little elephant on the night light, and she sleeps better with the red one. So, you know, once I realized about red light, I changed the color on the night light. Help a lot.
Yes, very calming.
Yeah, so it helps with, as an alternative to sleeping pills, it helps you relax. It helps get rid of sleep inertia. Basically, you're getting deeper sleep, just like this dog here. You getting good sleep here.
Yeah. Great. So this red light therapy has also shown great effects for skincare. It will increase collagen production and also skin elasticity and improve skin tone. So you'll see better, you'll see your skin more pretty, if we can say it that way. And also it has shown benefits on trials for eczema and psoriasis. For eczema, they tried red light therapy only 2 minutes per week, which was very surprising, very low, in 81 patients, and they did show reduction of itchiness and redness, and the appearance of the skin improved and the inflammation decreased, which were great results there. And then for psoriasis, they were doing 20 minutes every 2 days for 4 to 5 weeks, and this was very surprising. Patients had 60 to 100% clearance rate by doing this. And again, it decreased skin inflammation and patients were satisfied with the treatment. And psoriasis, I think, is one of those situations where functional medicine has some answers, but this might be very helpful to do for these patients.
And then, thank you, Mariceli. And then Meredith was doing some research while we were talking. Thank you, Meredith. She's finding that likely that the sunscreens are designed to block UV rays, UVA and UVB, but it can also block LEDs and etc. So it's likely that that makeup with SPF or sunscreen would also likely block infrared and red light too.
Mm-hmm. Yes. Thank you, Meredith.
Thank you, Meredith. Yeah. Yeah, so red light so red light helps you get pretty skin, right? Who doesn't want that? That alone is probably enough to to try it out. I think that's really, and I've definitely seen and heard people that there's like, my skin's glowing. You know how like people come up to you and you always want people to say, hey, your skin is glowing and all this stuff. You look great. Red light therapy can do that. That can really help, along with acupuncture, along with other aspects that are going to be helpful for your system. Red light therapy for cognitive functions. This is one of the areas that I really like, is brain health, because you need a healthy brain, and without a healthy brain, what good are your other organs, basically? So near infrared light can reach the brain. There's an interesting way, because it's not really penetrating your skull directly, because you have a cranium, you have bones, and everything. How's it getting there? It's getting there, like what Sarah's question was, from the bloodstream. So you're getting a whole body exposure, then those photons are going to the brain through the circulation. So the brain benefits from increased cerebral blood flow, more oxygen availability and consumption of that oxygen, so it can turn into energy and boost the ATP energy production. Now, the first placebo-controlled human trials for red light therapy, Alzheimer's, and dementia showed a trend of improved EEG amplitude. EEG is the brain map, like a brain map test that we do here at the EEG. And a trend of improved amplitude on the EEG and connectivity measures. So basically, the brain waves were more active. There was a higher amplitude, higher power, and then the brain was also talking. The brain neurons, rather, the cells of the brain, were talking better to each other. There was increased cognitive function. There was better sleep and less wandering. So if you have someone that's wandering at night, maybe that would be a good thing. Fewer angry outbursts and less anxiety. And there were other positive changes, like help with improvements in executive function, immediate recall, memory, and you see those there. So the conclusion is that there is potential for home treatment for red light therapy as well for brain health.
Yes. So also it has shown very good results. Actually, with patients that I've been doing red light therapy here in the office, I feel like the three main benefits that they say is energy, mood, and both pain, I would say, and skin would be like third place of like things just anecdotally that I've heard here from patients. So that's pretty good. And we see they've stated that seasonal depression affects has a rate of 5% of the population here in America. And one of the main risk factors for this is just not getting enough sunlight. So that's why, since natural light will like boost cerebral metabolism, it can increase neuroplasticity, decrease brain inflammation, and get more oxygen to our brain. That's why the red light therapy can improve symptoms of seasonal depression. And research shows that doing the red light therapy daily for 8 weeks might improve mood. So it might be a non.
So what if depression, which is we say in functional medicine is brain inflammation, what if depression was a light deficiency? What if depression was a sunlight deficiency, right? That's pretty revolutionary. It's like instead of being stigmatized and you got to take SSRI for the rest of your life, what if getting outside in sunlight and doing some red light therapy would help boost that energy to help reduce brain inflammation so that your mood was better? And this is really cool from the APA, American Psychiatric Association, you know, that there's research that's pretty interesting. Daily red light therapy would improve mood if done for 8 weeks. Susan asked a question. Thanks, Eric. So Susan asked a question. Thank you, Susan. Hey, Susan. Susan asked what is the difference between home and office treatment for red light therapy? We can either answer that now or at the end, but you know, it sounds like it is, you know, there are some home devices. There are more professional devices that you can also buy for home as well, though.
Yep. Yes, there's definitely smaller versions than doing the full body treatments that are a little bit more expensive, but smaller versions of the one here in the picture. There's also a version to go traveling and things like that. So there are different options for that. Yes, so we can also see a little bit of the benefits for red light therapy for cardiometabolic health. So this will help us boost the nitric oxide, and this is a gas that is important to vasodilate our vessels. This will mean that we'll have less blood pressure, blood can flow easier through our system and decreases inflammation. There is also a little bit of research that it can help us decrease fat, that it can help us use fat more efficiently as energy, but there was little research on that. But also help us protect our heart tissue. It can boost PER2, that is a gene related to a clock gene that can also protect the heart tissue, and increase cardiac adenosine that helps regulate blood flow throughout the body. So also related cardiometabolic with blood flow and inflammation and decreasing inflammation.
So thyroid. So another area that a lot of people are concerned or interested in is thyroid health. So there's been at least 6 to 7 studies on thyroid health, red light therapy and thyroid health. So for patients with Hashimoto's, which is an autoimmune attack on the thyroid, or called autoimmune thyroiditis, interventions with red light therapy showed less of a need for T4 thyroid hormone, which is called levothyroxine. That's a medication. 47% of the participants in the light therapy group no longer needed levothyroxine at all after 9 months, which is kind of mind-blowing, you know, to me. These are things that, you know, we haven't tried as much here, but then looking at, can light stimulate the thyroid, which gives you more energy, reduce the inflammation, and somehow that helps the immune system to reduce autoimmune attack on the thyroid. There was a decline in thyroid peroxidase antibody, and there was higher rates of vascularization of the thyroid lobes. So that's pretty interesting. Those are pretty interesting and interesting things here. And then for the ketogenic diet, so basically a higher fat diet, a lower carb diet, where you essentially start producing ketones in your urine, you start to burn fat instead of sugar. What happens is a lot of us have metabolic syndrome. 90% of the population has metabolic syndrome, which is basically this metabolic inflexibility where people are mostly not able to burn fat as much, and they're kind of dependent on carbs and eating too many carbs, craving carbs, and really able to just burn off carbs. sugar. So RLT amplifies the effects of the ketogenic diet and increases metabolic flexibility so that your body can switch train tracks in terms of burning both sugar in terms of carbohydrates and burning fat. And this concept of ketosis sensitizes cells to the action of a pancreatic hormone called insulin so that you can burn fat better. So there was a male and female study, 12-week intervention. They were all adults, and they did, one group did a ketogenic diet plus red light therapy for 4 to 5 times a week, and the others did a standard American diet, a SAD diet, a control group, pizza, just, I don't know, not a lot of vegetables kind of thing, plus red light therapy for sorry, pizza lovers, and pizza tastes good. So, but SAD diet plus red light therapy 4 to 5 times a week, and the results showed that preliminarily that red light therapy, in the context of having serum ketones above 0.5 millimoles per liter, increased the healthy expression of sex hormones, so literally boosting adrenal hormones like DHEA, but also progesterone and other sex hormones in both men and women. So again, a non-invasive way to improve your hormone health, whether it's adrenals, thyroid, or sex hormone, would be red light therapy. In this setting, in the case of this setting, in combination with a ketogenic diet.
Right. So on the same note, we can see that there's studies that has shown that it can also boost testosterone. So it's normal that around after age 30, testosterone levels slowly start to drop. But studies have done that has used red light therapy, especially a 2016 study in Italy that evaluated 38 men. They did daily red light therapy in the mornings and showed a significant rise in testosterone levels and higher sexual satisfaction. So it might be another way of increasing hormone levels. The control group that wasn't doing red light therapy did not show any rises on levels. So that's also very
going back to the eyes, Dr. Applebaum wrote in the chat, thanks for coming in and commenting here, Dr. Applebaum. Dr. Applebaum is an expert in eye health. He wrote that red light therapy has been shown to almost recharge the energy system in the retinal cells that has declined with aging, seen in macular degeneration. So it sounds like the way it works for macular degeneration, and correct us if we're wrong about that, if I'm wrong about that, Dr. Applebaum, it would help cataracts and glaucoma also in the same way with mitochondrial regeneration, or is it also with more like blood vessel health and opening up the blood vessels? That would be an interesting, but we know it does help with macular degeneration. I think that has the strongest evidence. I'm not sure about glaucoma and cataracts. It'd be interesting if Dr. Stan had something to say about that. Let me see. Insurance, yeah, we do bill it. We bill it as a very short office visit. We basically take vitals and do some medical evaluation that will bill a short office visit for that. That's what we typically do here. There are other models. Obviously, we try to do as much on insurance as possible to make it as accessible for people. Other places may do cash, so we're able to do that through the medical side. Besides that, let me just to make sure we get to this. How often do people come into the office to notice a difference? I don't know. I've noticed a difference even 1 time a week, but I think the recommended is 2 or 3 times a week based on studies.
Yes, the patients that have been happier, like with the results, they were coming more often, like 2 to
3 times a week. Yep. Muscle recovery. So red light therapy. Do you want to do this one, or I don't know if that's.
Sure. It will the same increase the energy production of the cells, so it'll decrease the muscle soreness and fatigue, speed and increase muscle recovery and growth that has been proven clinically, and more antioxidants will also decrease muscle fatigue. So coming to the basics, this will help fitness, anyone that likes to work out, if they have like red light at home after, that'll be great to do to support muscle recovery.
Nice. Gotta work out before work and then go into the red light machine.
Yes, and this is just the last one of the benefits that we can touch on real fast before we finish, is the red light therapy and gut health. So research has shown that our microbes that live in our gut, so our gut microbiome, change during the day. So they do follow the circadian rhythm, all in function and composition. And also this has been shown that the red light therapy can have a photobiomodulation effect on the gut microbiome. And we know that gut microbiome is important for digestion, metabolism, immune system, sleep, brain health. So it actually affects the whole body. So if the light can affect the gut microbiome and also the gut microbiome can affect all of our body, it's very important to see that this red light has shown to have positive effects. They still are trying to figure out what are the changes and how can this affect, but they did show that it was beneficial. So just one more good thing to notice on this that can have positive effects. And these are a few brands. Juve is actually the one that we use here in the clinic, but there are a few others. I just put here 2 examples if you're interested in looking into more information of what they are
Yeah,
and
and
the
yeah, I
prices.
want to say that they always put these models on these posters, and it's like it's more than just like skin deep. This is really about, this is really about optimizing your immune health, your hormone health, your gut health. That's that Photobiomics is amazing. Getting outside if you don't have access to red light is huge. Honestly, for this person with the light, I mean, they probably want to wear more like a t-shirt and shorts to get more light exposure, because if you're wearing
Right.
clothes outside, it's not really helping you. But yeah, you're basically getting outside, getting a sunlight, getting some of that natural light. And the red light's going to happen more, I think, in the evenings too. You can have it like in the mornings and the evenings. That's a good time for red light too. I think Susan, about the I think, let's see, how you can buy some of these professional grade devices for home or office. You definitely can do that. It just depends on what you want to spend and all that stuff. So I don't think there's much difference there, except that sometimes the home ones you can buy smaller versions of them. And everything. And then, brands. We like the Juve here. Platinum LED is supposed to be really good too. Margaret asked about pets. I think they would be helpful. I don't really know the research,
I
if there
did
is
see
any
a post
research.
from Juve with the little dog using the red light too. I'm not sure.
I
Like,
mean, yeah, it's like, I feel like light. Most, unless the creatures are living in the deep sea, most of us that are on the Earth's surface probably need light. So I would think it would be helpful for animals too. Yeah.
mhm.
Unless they burrow in they're not like into all that, and they're more like living underneath the surface or something. Red light therapy probably improves the blood vessels function on glaucoma, but difficult to determine. Thank you, Stan. Yeah. So a lot of these kind of therapies we're talking about are proactive, right? It's about optimizing wellness to prevent or reverse illness as a side effect of optimizing wellness. That's what red light therapy really is. So, thank you for all your questions today. It's about 1
Yeah,
o'clock.
thank
Can
you.
wrap up here, but it's been really great, a great session. Thank you, Araceli, so much for this. It's been an
Oh,
amazing
thank
talk,
you.
and thank you so much. Thank you, everyone, for attending
Thank you
today.
everyone for joining. It's been a
Okay, we'll
pleasure.
see you next week. Thank
See
you.
you next.